Welcome everyone to this month's episode of ZOLEO Campfire Chats. We're so excited to have you here with us today. Whether you're a novice explorer or a seasoned outdoors expert, this is a space where we can share ideas, learn from one another, and grow together. I'm Lauren from ZOLEO, and I'll be your host for today's session. Before we dive in and introduce today's guest speaker, I'd like to go over a few quick housekeeping notes just to ensure that this is a fun, engaging, and positive experience for everyone. Your comfort comes first. Think of this as a cozy campfire chat, a place to relax, be yourself, and enjoy some great conversation. If you'd like to jump in with a question or a comment, just pop it into the Q&A box in the top ribbon. We'll do our best to bring as many of your thoughts into the discussion as we can. During the presentation, guest cameras and mics will stay off so that everyone can enjoy the session without distractions. We've also got a few awesome folks from the ZOLEO team here with us today. First up is Lou, our product expert. He'll be tackling any of your ZOLEO or product-related questions live in the Q&A box. I'd also like to welcome Sammy, our moderator for today's session, who's keeping an eye on the Q&A and will be running the Q&A segment later on. And finally, just a friendly reminder, let's keep things kind, respectful. We want this to be a positive space where everyone feels welcome to share and connect. With that said, I'm so excited to introduce today's guest. He's led high-altitude rescues on Everest and disaster responses in Nepal. He designed emergency action plans for NASA, SpaceX, and National Geographic, and he's launched Puerto Rico's premier concierge medical clinic from the ground up. Please welcome Jeff Weinstein from Global Rescue.
Hello, everyone. It's good to be here. I'm happy to answer questions. I'll take questions at the end of my presentation. You can just put any questions that you have in the QA box at the top. I'm going to share my screen, a little presentation here as we walk through some of the things that you can do to help survive and thrive in a wilderness setting. So my name is Jeffrey Weinstein. I am currently the operations manager for Global Rescue. I'm a certified wilderness paramedic. I have 21 years of experience in emergency, pre-hospital emergency medicine. So I have partaken in multiple austere rescues, hundreds throughout the years that I've been at Global Rescue. I've performed rescues off of Everest and Mount Aconcagua, and I've deployed around the world to different medical emergencies. Global Rescue is an organization that provides worldwide integrated medical security and intelligence for our members. We perform medical advisory services, field rescues, and evacuations and crisis response throughout the world. We also offer the SOS monitoring for ZOLEO. So whenever you push the SOS button, it comes to our operations center. We determine where you are, provide medical advisory if necessary, and we'll activate the appropriate resources to get you a rescue. Let's talk about some of the essential gear for wilderness preparedness. What should you bring with you? Obviously, this is a very high-level overview of the things that you should have, but at a minimum, you should have a layered clothing system. Even if you are hiking in, the desert and you think it's going to be hot and you're only expected to be out there a couple of hours, things do go wrong. Problems can come up, and you may end up exposed all night long, and the temperature may drop. Or there could be a rainstorm. You get wet. When you get wet, you can get cold. Unforeseen circumstances can occur and can turn into an emergency if you're not adequately prepared. So it's a good idea to have a moisture wicking base, something that will take sweat and moisture away from your body. And then you're going to want to have something to insulate you. So an insulating mid layer, something like a puffy jacket, down, or synthetic down. Remember, down can't get wet. You want to keep it from getting wet. But it is the best insulating material for a mid layer, and then some kind of protective outer shell that's 100% waterproof that will keep everything dry. So some essential first aid supplies. You always want to have at least some level of medical kit with you whenever you go out into the wilderness. We're going to dive deeper into this and kind of discuss some of the things that I recommend having in your medical kit. If you're just going out for a day hike, you may not need as extensive as a medical kit as you would if you're going out for a prolonged trek or expedition. But you should include a medical kit that is tailored for the activity and environment in which you will be going and doing. Communication tools are essential. No one's going to know you need rescue if you cannot communicate or call for a rescue. So we highly recommend always carrying some kind of satellite communication device. The ZOLEO is amazing. It allows you to communicate 2 ways with your friends and family, as well as our operations center in the event of an emergency. So you should always have an additional means outside of your cell phone to call for help. Even if you think that you're going to have cell service in an area, you never know. So it's recommended that you carry additional communication tools with you. And then you should have some level of navigation and survival gear with you as well, especially if you're going into the deep wilderness. I'm a big fan of maps, having topographic maps of the area in which you're going to be going to as a last means of resort, a backup, and a compass, as well as a GPS. Don't always rely on your cell phone. It's good to have a standalone, GPS device that does not work based off of your cell phone connectivity. Fire starters, shelters, water filters, and purifiers are essential. Now, a lot of people think that they can just buy a water filter off of the shelf and they can just go and stick it in a water source and drink the water or filter the water, and it's okay to drink. Just remember that there is a difference between filtration and purification, and if it is a very questionable source, you will need to do both. You'll need to filter the water and then purify the water, which can be done with heat by boiling it, UV by exposing it to the sun, or via chemicals. So it's always good to have all of that in your kit just in case you need it and you find yourself in an emergency. We deal with hundreds of emergencies in the wilderness environment a year, most of them preventable if they had the appropriate gear and did the appropriate planning. Medical preparedness in the field. So let's talk about building a medical kit. So you're going to want your kit to be customized for your activity. You're going to want to make sure that it is the appropriate size and weight that you can carry correctly for whatever activity you're doing. So if you're biking, on a bike, then it's going to be a different size and it's going to have different things in it than if you're going on a 7-day trek into the wilderness. So, your medical kit should be modular in that you can add and take away things as needed. It's always a good practice to waterproof anything that is in your medical kit. We're going to talk more about doing this here on the next slide. But it's most important to protect things that if they get wet, they're no use to you. So always good to do that. You also need to ensure that you are knowledgeable and are trained on how to use the equipment that is in your medical kit. Don't just stick a tourniquet in your medical kit if you've never practiced with it, if you don't know how to use it or apply it. So there's plenty of good videos online that can train you in the basics of the equipment that you may put in your kit. And then regular maintenance on your medical kit is important. A lot of people build it and forget it, and then they go and open it up 5 years later, and everything's expired or wet and doesn't work anymore. So just make sure you check it. Make sure you check expiration dates, replace medications, and so forth as needed. Okay, let's talk about waterproofing. So the easiest way to waterproof something is with a Ziploc bag. You can put items like band-aids and bandages that may get wet into a Ziploc bag and close it. Or my ideal method is via vacuum sealing. So I'll take a food grade vacuum sealer. As you see here, this is what would be considered an IFAK, an individual first aid kit. It's specifically designed to stop massive hemorrhage and bleeding for yourself. And it's completely vacuum sealed shut. So that it is 100% waterproof. And then you can see in the upper right-hand corner, there's a little divot there that cut out with scissors so that you can easily rip it open as needed Just make sure that you don't cut too deep whenever you're making that little indentation there so that it destroys the vacuum. You can vacuum seal individual sections, which is my ideal method. Is I'll vacuum seal my medication section, I'll vacuum seal my wound care section, my hemorrhage section, my airway section separately, and then put them into my kit so that everything has its own little place and everything is vacuum sealed together per category or whatever I need. Or you can vacuum seal the entire kit. This is usually done in maritime environments. So, if we're doing, a helicopter rescue in a maritime environment, we may have to kick a medic bag over the helicopter and into the water. You can vacuum seal the whole bag, or if you're doing a boat trip or canoe trip or something like that, it may be a good idea to vacuum seal the entire bag to keep it dry. Of course, you would need a much larger vacuum sealer. All right, medical kit contents. So let's talk about some of the things that you should have. These are staples, in my opinion, that I like to put in every first aid kit. This is not a full list of how to build out a first response kit or an expedition kit. This is what I recommend. Personally, if I were to build a very, simple first aid kit that I would use on an expedition or an outing, just for myself, just some of the basics that I recommend having. So, bandages, always good to have something in which you can wrap wounds. You put gauze on a wound and wrap it with a bandage. So definitely bandages and then gauze. Gauze comes in different sizes. So I like to have, 2x2s and 4x4s for my gauze, as well as maybe something a little bit larger. It's called an ab pad, abdominal pad, or trauma pad, something that's a little larger for major bleeding. Antiseptic wipes for, just cleaning of the area. Adhesive tape, obviously, to tape different gauze and bandages. Antibiotic ointment is ideal, and Band-Aids. So hemorrhage control is important. A lot of people think, oh, I'm never going to lacerate an artery, so I don't need to worry about having anything to deal with massive hemorrhage. But we have seen it on multiple occasions with individuals who were not in battle. So, skiers and the like, getting major bleeding injuries that require tourniquet placement. So this is a tourniquet here. The important thing to be able to call something a tourniquet is that it has what's called a windlass, which is the stick you see in the middle there. And after you tighten the tourniquet down and Velcro it as tight as you can, you then turn the windlass multiple times until there's no pulse in the lower extremity and the bleeding stops. There are a lot of products on the market that claim to be a tourniquet, but do not have a windlass. Do not buy those. Those are actually considered constricting bands. They do have a place, but they are not a solution for a tourniquet. So if you're going to get a tourniquet, make sure it has a windlass. The combat application tourniquet here, also known as the CAT tourniquet, is what is used by the military currently. Hemostatic gauze, also known as quick clot. There's other forms of hemostatic gauze that use different kind of chemicals to stop bleeding. Quick clot is the most well-known and widely available. This is impregnated gauze, which means that the chemicals to stop bleeding are inside of the gauze itself. And as soon as it comes into contact with wetness, i.e. blood, it will start to congeal and stop that bleeding. If you're going to carry a tourniquet and or hemostatic gauze, you need to know how to use them. You need to be on how to use them. So there's a great course called Stop the Bleed that is a free course on how to use these things. I'm sure that you can find an online program or a local program if you're interested in doing so. Rolled gauze is kind of like hemostatic gauze, but without any kind of chemical impregnated into it. So it's just a bunch of gauze that's rolled up. This is very helpful in hemorrhage control for packing wounds, but also it can be used in splinting. Pressure dressing, also known as an Israeli dressing, is seen in this picture below here. It's kind of an elastic bandage and a trauma pad mixed together that you apply a lot of pressure to, and then you take the long side and you put it in that little white C-clamp thing over and over again, and you can apply a lot of pressure down onto the wound once it's been packed to stop bleeding. And then you have, obviously, gloves. Fracture and sprain support. So the items I recommend carrying in your kit for this are elastic wraps or elastic bandages. These are just very helpful for supporting the fracture or the sprain, as well as splints. There are multiple kinds of splints that you can buy. The best, in my opinion, is the SAM splint. And it is a very bendable, modular kind of splint system. It has some kind of metal on the inside there, but it's very moldable. And then it's soft on the outside. You can take a pair of trauma shears or scissors and you can cut it for an individual finger splint, or you can mold it to splint a leg or an arm. It is a great splint. They sell it rolled up or packed flat. I prefer the packed flat version for any kind of medical kit that you're going to be taking into the wilderness. You can find these on Amazon. Also, I would highly recommend watching a video online about how to utilize a SAM splint effectively. There are multiple things you can do with the SAM splint. This picture is not a great representation, but this individual is attempting to use it as a C-collar. He didn't do a very good job, but I just wanted to show you what a SAM splint was on a non-copyrighted image. And then we have triangular bandages. Again, this picture is not great, but it is a triangular bandage. It's a large bandage that is in the shape of a triangle. You can tie two sides of it together, and you can make a splint for an arm. So again, you can, video search, video on how to make a splint with a triangular bandage. It's a very simple process, probably a 3-minute video, and it's a great technique. Burn and blister care. So burn gel is good in case, you're around campfires or boiling water. It's important to be able to treat any kind of burn before it becomes an emergency, or even if it is an emergency, it's ideal to be able to stop the burning and apply care immediately. Sterile dressing for burns, and then moleskin. So blisters are a big problem when you're out in the wilderness. They can become a very limiting factor if they're not treated effectively. So being able to apply moleskin to a blister before it becomes a big issue is important. Let's talk about respiratory and airway. These are probably a couple of things you have never seen or heard of unless you have done an EMT class. But there's oral pharyngeal airways, or OPAs. These are airway devices that you can place into someone's airway to keep their airway open if they are unconscious or unresponsive. OPAs are used when an individual does not have a gag reflex. If you're unsure if they have a gag reflex or not, if you try and put in an OPA and they start gagging, they have a gag reflex. Take it out. Do not force it in. Do not let them vomit. If they vomit, you're going to want to turn them on their side. OPAs are very important for securing an airway if the individual cannot secure their own. There's also something called a nasal pharyngeal airway, or an NPA. They are tubes that go down someone's nose with some lubricant, and they also help to secure the airway. So you can use one or the other, and I recommend carrying at least an NPA in your kit. There's different sizes, and again, these are videos and training that you should watch before you use them. You have to learn how to measure each tool and use them correctly. I know that's probably beyond the scope of most people, but really when it comes down to treating someone who's unconscious, unresponsive, and cannot secure their own airway, it's important to be able to have the tools to be able to do that. And a CPR shield or mask to prevent yourself from being exposed to someone who may need some kind of rescue breathing, even though breathing during CPR is no longer recommended, but rescue breathing is in someone who is not breathing. Other medical kit elements. So it's important to have over-the-counter medications in your medical kit. We see a lot of times individuals requiring rescue for emergencies that didn't start out as an emergency. It started out as a very simple manner that probably could have been solved with the correct over-the-counter medications or medications in general, but they did not have access to. An example that we frequently see is severe diarrhea. Someone got diarrhea, they could not stop the diarrhea, and they're in a remote, austere environment where they're exerting themselves, and now the diarrhea, in combination with the activities in which they are doing and the environment that they are in, has caused some kind of electrolyte imbalance, and it then becomes an emergency. So having medications to effectively treat that is important. You're going to want to have some pain relievers, ibuprofen, Tylenol, that kind of thing, NSAIDs, nonsteroidal anti-inflammatories. You're going to want to have antihistamines. So an allergic reaction is a deadly emergency. It can be, especially you don't know the people who may be traveling with in a group may have a deadly anaphylactic reaction. Hopefully they're carrying an EpiPen with them if they do, but having access to Benadryl is super important for emergencies. And then your general antihistamines for, just rhinitis or getting exposed to, sniffles or anything like that, that you might get congestion when you're outside. So something like Claritin is important. Antidiarrheals are super important. And then motion sickness medication if you're going to be doing anything on the water, but it can also be used as what's called an antiemetic or a medication to help prevent some nausea. Some of them have a side effect that helps with that. And then electrolytes. And then for environmental and exposure, we're going to want some instant cold packs if you can spare the weight and the size of those. Emergency blankets are frequently sold and told that you can use them in an emergency to help insulate yourself. And really, they're not super ideal by themselves. So don't ever try to use an emergency blanket alone to try and insulate yourself against the elements. It should be a layer in something that's called a hypothermia wrap, but not used by itself. So an emergency blanket is a great tool also for signaling. They tend to be very bright. They tend to be reflective. So signaling for a rescue, an emergency blanket can be used. But in a use case for trying to keep someone warm or stabilize someone, you're going to want to get them off of the cold environment like the ground. You're going to want to remove any cold, wet clothes. And then you are going to want to put them in a sleeping bag or some kind of insulating layer, and then an emergency blanket, and then having a tarp over top to keep them completely dry and protected from the elements and the wind. Insect repellent and sunscreen are obviously important mitigating factors for any kind of vector-borne or sun exposure that could cause injury or ailment. Tools and essentials, trauma shears, they're specialized scissors for cutting through clothes, as well as some like metal, like zippers and things like that. Important to be able to expose any injury. Tweezers, thermometer, safety pins are helpful if you don't have a lot of equipment to be able to create a splint. If someone injures or dislocates an arm, you can pull up the bottom of their shirt and you can pin it to the top of their shirt and create an improvised splint that way. Medical tape, flashlight, and some kind of signaling device. Personal and medical information, you're always going to want to have on hand a copy of an ID, insurance, an allergy list, medical condition list, and emergency contacts that you can hand off to any rescuing party or treating team. It's also important that you remember, it's not part of a medical kit, but always remember to take your prescribed medications with you and more than you think you will need. So if you're only going out for 3 or 4 days, you should have 7 days of medication just in case you get stuck. And some of these prescribed medications can be really important. Also, before you go on a really long expedition or trip or journey, it's always a good idea to have a travel medical consultation with a physician who can talk to you about the correct prophylactic medications you should take or get or have with you in the event of issues that may arise and where you're going. So if you're going into the mountains, there's appropriate medications that you can take with you. If you're going up to an elevation above 8,000 feet, that can significantly help you acclimatize as well as treat any kind of high altitude ailments that may occur. If you're going somewhere that is prone to vector-borne or mosquito-borne diseases, then having the appropriate medications there. And they can also provide you antiemetics for vomiting and nausea and things like that are prescription that you could not get over the counter. Communication and navigation. So when you're talking about using a satellite device effectively, we always want to make sure that we preload emergency contacts and that you inform your emergency contacts of the trip details so that they know where you're going and they know the timeline of your trip. So you should tell them, hey, I'm going here at this date, this time. You can expect me to check in around these times. You can expect me back to my vehicle or back home by this time, so that they understand that if you miss a check-in window, that they should activate rescue, and they'll know a general area in which you are traveling. So failing to have an emergency backup, someone who can activate resources if you're unable to do so, is crucial and can save lives. Optimal device positioning. So it's a satellite device. It has to have availability to see and communicate with the satellites in the sky. If you are surrounded by a bunch of concrete and metal, it can cause device interference. If you're inside or in a car, you may not be able to connect effectively. So always make sure that you have a clear view of the sky to maintain a reliable signal. Satellites are on a constant rotation. Just because you do have a connection doesn't always mean that the satellite will be overhead and be able to pick up a signal. So always make sure that you are waiting for a good signal to connect whenever you're trying to send out a message. Now, if you have a ZOLEO and you activate an SOS through the app or through pressing the SOS button, then the device will continually ping until a satellite comes overhead and it gets a connectivity. But always make sure that you, in the event of an emergency, try and maintain a clear view of the sky at all times. I also want to emphasize the importance of having the app connected to your device if possible, because having two-way communication with rescuers is super important. Power management, carry extra batteries and chargers to keep any kind of satellite device you have functional throughout the trip. Make sure you have a way to charge it. Make sure you have backup means to be able to power it if needed. And then you want to practice and familiarize yourself with your device. Always know how to use it, how to activate an SOS, how to deactivate an SOS, how to send messages, what it looks like when it's connected, what it looks like when it's not connected. And then you're going to want to test your device to ensure that it's completely operationally ready before you go out into the field. ZOLEO has the ability to do this through your app. You can send in a test and you can do a function test of your device before you set out into the wilderness. Terrain and site familiarization. So you're going to want to do this before you go on any kind of prolonged outing in an austere environment. This is a step that is frequently overlooked by people. And you just want to do a quick study of the resources and the things in that area before you go out somewhere that you're unfamiliar with. So understanding the terrain and the hazards of the area are super important. You're going to want to look at maps. You're going to want to look for hazards, study where cliff drop-offs may be, or there may be rivers or unstable ground. Flood zones is super important, especially if the area you're going to is prone to flash flooding. Understand what that looks like, understand where those zones are, is just an important, hazard mitigation step. So navigation and landmarks, you're going to want to recognize major landmarks in the terrain in which you're going to be going. Kind of try and plot your path and understand, okay, there's a big, there's 3 peaks over here to my right, and when I'm looking over to my left, there's a river down there in the valley, so that you can kind of help to understand where you are in the terrain and where your waypoints may be. Access and egress routes. So knowing safe entry and exit routes to ensure effective access and emergency evacuation if needed. Hopefully you're in an area in which the rescuers are familiar with the terrain, but if not, you may have to help guide rescuers into your location. Additionally, you may have a problem in which doesn't require activation of 911 or emergency resources, but you are injured and you need to get yourself out, or you need to call for help. It's good to know what assets exist in the area and how they can get to you, and what resources exist to get you out. And then medical facilities and risks. So you want to pre-identify nearby medical facilities and assess environmental risks. It's important to understand, if you're traveling in a remote place in a country in which you may not be familiar with, or even your own, if you're going super remote, top level medical or trauma facilities just may not be available. And if you get into a major emergency, then, understanding the level of care you can get locally and understanding that you may have to be moved is important. So emergency response and rescue. How do you get rescued? So everyone here is likely a ZOLEO user. So in your event, you're going to push the emergency SOS button or activate it via your app, and it will relay your GPS coordinates. If you do not have your ZOLEO and you have some other kind of communication, maybe a cell phone call, you're calling for rescue, maybe you have a satellite phone and you're calling for rescue, then you're going to want to accurately relay your GPS coordinates and any kind of important terrain features that may exist in the area in which you are located. You're going to want to provide a patient status report. So providing the number of patients, if it's a mass casualty incident or an incident where there's multiple people who have been hurt, that's important for rescuers to know. If it's just one, then it's just one. The consciousness of the patient, any vital signs that you may have if you know how to take them, and then bleeding and airway status. This helps the rescue teams understand the criticality of the situation, as well as plan for any kind of medical intervention that may be required whenever they get on scene. Use of visibility aids is important. So smoke signals you can do if you have to, light a fire and you put green vegetation on top of a fire, it can cause some good smoke, and then you're going to want to fan it and create different smoke signals. You can use flares, but a great device is a VS17 panel, which is a very bright neon reflective SOS panel that it easily folds up and is placed in a backpack. But all rescue flights and helicopters know what a VS17 panel is. They know it means SOS and rescue me, and it's a great tool to have to signal in case rescue is needed. And then preparedness and situational awareness. I can't say it enough. Training and training with your equipment is crucial. All right. So a lot of people don't think that they are going to ever get into a situation whenever they're traveling or they're going out remotely. And I just kind of included some case studies here, or just some examples of cases and rescues in which we've had where normal individuals found themselves in an emergent situation. So we had a leopard attack in Botswana, where someone was in a remote hunting camp in Botswana. A leopard attacked them, bit their calf. They had some significant injuries to their calf. They had multiple penetrating trauma wounds. And then the member themselves had a blood clotting disorder, which caused some significant complications. And we successfully evacuated them to a higher level of care in South Africa. We had an individual who was in a remote area of Iowa that was cutting with an axe, slipped, hit himself significantly in the lower leg, required a tourniquet placement, and we had to get him rescued to a hospital. And last one, we had a case in Nepal and Mount Himlong where a climatologist was doing research. He fell 70 feet down into a crevasse. He sustained multiple traumatic injuries during the fall, and including, broken clavicle, multiple broken ribs, internal bleeding, and he was able to get himself out of the hole with one arm and an ice axe, and call for rescue. And we were able to give him some survival advice to survive the night, since it was nighttime. No helicopter was going to come because they don't fly at night in Nepal. And we gave him survival and treatment advice, and then coordinated the rescue for him in the morning. The point of this is to be prepared, and to always understand the risks in the areas in which you are going. And effectively mitigating risk is the first step in treating yourself and making sure that you're not a victim to any kind of significant emergency that can be prevented. And that is all I have. I am open for questions.
Awesome. Thank you so much, Jeff. That was an awesome presentation. I know I picked up a lot of great insights, and I hope you all did as well. Just before we move on to the Q&A, I do want to remind everyone that we have a giveaway going on today. So every attendee will be entered for a chance to win an individual first aid kit as well as a ZOLEO swag pack. Winners will be contacted via email after the show, so please keep an eye on your inbox in the upcoming days. Now on to the Q&A. I'm going to pass it over to Sammy to take us through a few of the questions that you've left for Jeff.
Hey everyone, thank you for joining us today. I'm Sammy and I'm really excited to be here. A big thank you to Jeff for sharing his insights. You've really asked a lot of fantastic questions for him, so let's kick things off. So Jeff, the first question is, should gloves and medical kits be nitrile? And what do you recommend? Do they need to be sterile?
So nitrile gloves is ideal. Latex gloves are not good because there's a lot of people that do have latex allergies. Nitrile is the standard now. They do not need to be sterile. Most gloves that are used in a hospital or EMS setting are non-sterile gloves. The only time you use sterile gloves is for surgeries or major injuries that you may be debriding. So non-sterile gloves is fine.
Okay, amazing. Good to know. The next question is, do you have any general thoughts on using or not the things you already have on hand for those in the backcountry trying to keep their packs lightweight, like hiking poles for splints or makeshift tourniquets or anything like that?
Yes. So you can absolutely use hiking poles as a splint. Having some base medical supplies is ideal to be able to effectively leverage improvised things. So if you're going to use a hiking poles as a splint, you're going to need to put it on both sides of the affected extremity, and then some kind of elastic bandage around it can really help to use it as an improvised medical device. As far as improvising a tourniquet, research shows that that's a good way to kill yourself or kill someone else. So it's not very effective if it's not done correctly. So I would recommend a tourniquet is one thing. If you're concerned about that, you do buy an actual professional grade tourniquet, and keep. But improvised medicine is a whole other topic on its own. I've been through an entire 2-year training program that included improvised medicine, austere medicine. It's great. There's a lot of things you can improvise, but again, having some core medical equipment as a base does help you to do so effectively.
Okay, good to know. And the next question is, what are the most common mistakes that you see in relation to preparedness?
Not preparing. Not doing the research, not understanding the environment in which you're going, not packing the appropriate clothes to, stay overnight, if you don't expect to be going overnight, and then not having a means to call for effective help and communicate during an incident. And like I said, during the talk, not having appropriate equipment or medications to treat less emergent conditions before they turn emergent.
Okay, yeah, those are pretty crucial to know. And I guess that kind of leads into the next question too. If you don't have and additional GPS or maps, what's the best way to determine your coordinates?
If you have a phone and I mean, it depends on if you have Apple or Android, but they both have the ability to go to the maps function and figure out what your coordinates are, where you're located, or there's a compass in which will likely tell you what your coordinates are in the area in which you are located.
Okay, good to know. And I guess it's kind of good that ZOLEO still shares GPS coordinates as
That's
well.
right.
So
Yeah. Yeah,
that's
if you have your ZOLEO, then you're good because it tells us exactly what your coordinates are, and we get that information from your ZOLEO.
yeah, that's really simple. Next question is, I'm also interested in suggestions on the ultralight emphasis and how that relates, even if you think it's not an area where you skimp.
Yeah, I mean, there's definitely things in which you can pare down. Like I said, your medical kit should be tailored to the activity and environment in which you're going and what you're doing. If you're going ultralight and you're trying to pack extremely light and small, a vacuum sealing is a great way to do that. You can compress a lot of things into a very small container, and then I would just pare down the amount of equipment I bring, and I would bring the essentials. So I would definitely bring medications. I would bring some basic things for wound control, but maybe not like a whole pack of band-aids, right? You're going to bring a couple. You're going to bring a couple of bandages and stuff, and you're going to vacuum seal it, and it's going to go from this to this, and it's going to be pretty lightweight. You don't need everything on the list, but choose the things that can save your life and treat your infection or your injury effectively.
Yeah, I personally think that vacuum sealing anything is so satisfying. So especially when it comes to things that could save your life, it's so important. And the next question is, how does Global Rescue respond when there is no two-way communication due to cell phone being far away or it's broken or only the SOS button was pushed?
Okay, so that's a multifaceted question and
Sorry.
answer. No, that's fine. So we have a Global Rescue's core business, parent business is different from the SOS monitoring we do for ZOLEO. So if you have a ZOLEO device and you don't have any two-way communication, you don't have your cell phone connected to the ZOLEO device, and you push the SOS button, if we don't get a response from you and there's an emergency, we activate emergency resources. So we're going to send help automatically. And then if you don't have your ZOLEO and you are a Global Rescue member, we have to have two-way communication in order to send a rescue. But it's a little different because we have paramedics, nurses, and physicians. We assess the situation, and we also pay for the rescue. So that is a little different, where we have to 100% confirm that it is an emergency and requires a response before we activate a rescue.
Okay. I think you answered that question perfectly considering how layered it is. And the next question that our audience had for you is, are Reco backpack rescue reflectors helpful in locating patients for rescue?
Yes, rescue reflectors are definitely helpful. Again, providing coordinates is ideal, your exact location, and not moving from that location after you call for help is the best way to signal a rescue or to make sure that the rescuers know where to find you. But any device that you can use to increase your visibility, reflecting light or flare or anything like that is a great additional tool.
Funny enough, that actually leads into our next question, which is all about discoverability. What are your thoughts on a whistle or a lightning protection? There are many schools of thought on lightning.
A whistle, I mean, I don't think. I mean, a whistle could be okay in the event that there's a ground rescue that's occurring to go get you. But if it's an air rescue and we're sending a helicopter or rescue team that way, then the whistle isn't going to really have any effect. Also, though, a whistle is hard to triangulate exactly where it's coming from in the wilderness environment. It could sound like it's coming from a lot of different places depending on the environment in which you're in. But it could be helpful. As far as the lightning thing, I'm not exactly sure.
The lightning protection?
I mean, as far as lightning protection is concerned, it's ideal to stay below tree line in the event of a storm and don't go, above the tree line. And as far as like lightning protection, I've never had much exposure with it, so I'm not sure.
Okay, good to know. Now the next question is, do you have specific recommendations for surviving remote winter cold emergencies, especially falling through thin ice or having a traumatic injury?
So winter cold emergencies. Yes. So falling through thin ice is dangerous. Obviously, it's hard to get out of the thin ice. So that's, if you can get out, then the first priority action is to get dry. Staying wet is what's going to kill you. But I mean, if you don't have help and you don't have the right equipment, you don't have dry equipment, it is going to be hard. So calling for rescue immediately, getting dry, getting off the ground, preventing as much exposure as possible, protecting yourself from wind. I mean, we're talking about a real life and death situation here. If you fall through thin ice into water, and you're exposed. So hopefully you have other people with you. You have dry resources. If not, then you have to hope that rescue gets to you quickly. But getting out of whatever's wet, getting dry, getting off the ground, protecting yourself from wind or exposure of the elements is crucial. Also,
Yeah, absolutely.
in my pack, I carry trash bags, big black trash bags that are rolled up real tight, and little tea light candles. And I can use the trash bags for a couple of things. I can wrap it around some green trees, and it can create a transpiration bag where the water gets evaporated. It hits the trash can, and you can hit it and get drinking water from out of a tree. But you can also use it for cutting a hole in the top, like tearing a hole in the bottom of the trash bag, putting it over your head and over your shoulders, all the way down to your legs, lighting the candle, putting it between your legs and hovering over it like this. It will almost act like a heater and warm you up, gradually. It's surprising how much heat a little candle like that, when it's contained in a trash bag, can help to heat you up.
I never thought there were so many different ways to use a trash bag, but that's really interesting.
Oh.
The next question our audience has for you is, would you use SAM splints for C-spine?
Not if I could help it. C-spine is one of those topics that is highly contested right now in emergency medicine. So it used to be that we would C-spine everything, any kind of significant, fall or car crash or whatever, it would get C-spine, complete C-spine precautions. And we've moved more into assessing the C-spine thoroughly, and only if we are significantly concerned about, a spinal trauma, do we actually apply a C-spine. That being said, we recently had a case where someone fell down 20 feet onto his head and neck and fractured his spine and is now paralyzed. And that, in the event you go and respond to that, that's obviously going to be something in which you C-spine, or if you're in a group where that occurs, you're going to want to take C-spine. Now, if you don't have the appropriate things to C-spine, I would just hold C-spine, hold the head and the neck completely straight and in line if you can, rather than messing around with trying to improvise a C-spine. So you can use a SAM splint as to secure C-spine if you know what you're doing, and if it's the only means in which to secure C-spine, and you have to get out of that environment. Otherwise, I would manually secure C-spine and wait for rescue.
Oh, I see. Okay, that makes a lot of sense. We're going back to an earlier question because I think I may have not understood the context properly, but it's back with the lightning protection. They were not talking about lightning protection like a shield, but what to do. For example, some say that if you go to a cave, it's more dangerous than being out in the open. So what do you do with someone that was hit by lightning?
Okay. So yes, staying below tree line is ideal, and getting into some kind of shelter is important. But if you're, I mean, there's times in which you may find yourself, especially if you're hiking in the mountain areas, where it lightning can come from all around you in a significant storm, and
Mhm.
there's nothing you can really do to 100% protect yourself from lightning. But staying below the tree line is important, and getting into a shelter if possible, and getting yourself off the ground is important. Staying away from metal, that kind of thing. Now, getting struck by lightning can kill you. So it's rare. It happens. But if you're in a group and someone gets struck by lightning, then you need to start CPR immediately and call for rescue. If they don't have a pulse, check a pulse first. Obviously, don't start CPR if they have a pulse. But
Yeah.
yeah.
I mean, that sounds super scary, so that's important to know. The next question I have is, what are typical response times in the US and internationally?
Huh. Good question. This is a question we get very frequently,
Mhm.
and there is no answer. So the answer is it is very dependent. It's a very dynamic situation. Every time, every rescue is different. Every environment is different. Rescues are dependent on a lot of factors. Those factors are the location in which you are in or at. If it took you 7 days to get where you are by kayak and boat and riding a camel and hiking, we're not getting to you in 30 minutes on a helicopter. If you're super remote, and it is going to take some time to get to you. Not everywhere has access to rescue resources like helicopters that can come via, air. It may be a ground rescue, it may be a ground team, it may be a bush plane or a float plane. So it's really dependent on what assets are available locally. And then if those assets do exist, then the weather and time of day plays heavily into the rescue response time. So are those assets out on another call? Are that they're going to triage, right? If it's 911, they're going to triage, which scene is more important. So that may delay rescue. And then if they are available, if they helicopters and planes have VFR, visual flight rules, or IFR, which is instrument rating. If they're visual flight rules and they're not rated for instruments, then they can't, and they don't have night vision, then they can't fly at night, and they can't fly during bad weather. If they're IFR, then they can, and they have night vision rating. So it really depends if they can fly at night and if they can fly during bad weather. But even if it's a significant storm, they won't fly. If there's a lot of snowfall, they won't fly. If there's high winds, they won't fly. So really, weather is extremely it's extremely weather dependent and time of day dependent as well. So availability, time of day, weather, location, criticality of the event are
Yeah,
determining factors.
that makes a lot of sense. And I guess in that sense, it's good that we have this talk because there's so many things that can really interfere with making a rescue easier or harder.
Yeah, I mean, we
Then
have rescues sometimes that'll take 3 or 4 days to completely enact, right, and get that person out of the wilderness. So that's why it's super important to be prepared and have the appropriate
exactly.
equipment.
Yeah, of course. The next question we have is, I'm on search and rescue, and you gave some great info. Great, Jeff. Um, Legality purposes, can we use an OPA or NPA without professional training, not just a video online?
Yeah, I mean, you're working as you're not working as a responder, as a medical responder, right? You're a bystander essentially. So I don't think that a medical license or certification is required. You would be a good Samaritan. So I don't think there's any issues with that. But if you are a licensed professional, then you should definitely uh, check your protocols and policies and procedures.
Of course. And the next one is, do you have any suggestions regarding rescue insurance and who bears the cost of being rescued?
I mean, yeah. So good question. I'm partial to our organization, Global Rescue, even though we are not insurance. We are a membership organization. And our services, are come into effect mostly when you're over 100 miles from home. If you're within 100 miles from home and you're trekking locally, there is still some benefit. You can still get a rescue. I think it's up to $15,000 we'll pay for. You have to be off of the trailhead in an area that's not accessible by vehicle or easily. But if you're over 100 miles from home and you require something that we would call a field rescue, if you meet the triggers for, essentially life, limb, or eyesight, if you require hospitalization, your medical condition requires you to go to a hospital, then we coordinate and pay for the entire rescue. So there's no out of pocket, there's no claims process, there's none of that. So if you call us and we determine that you require rescue, then we coordinate that rescue and we pay for it 100%. I can't speak to other organizations. I don't know how they operate.
Okay, that's important information to share. Thank you for sharing that. And unfortunately, that's all the time that we have for today. Many of you have submitted some wonderful questions. And so if we didn't get to it, don't worry. Keep an eye on your inbox for the post-event recording, and we'll do our best to answer any of the remaining questions there. Thanks again, everyone, for joining us. I'm going to hand it back over to Lauren for a few closing remarks.
All right, folks, thank you all so much for being here and joining us for our second ever ZOLEO Campfire Chats. It's been so awesome interacting with all of you today. We can't wait to see you at our next session, but until then, stay safe, stay connected, and happy adventuring.